My name is Kristina Gligoric. I'm a PhD student at UPFL, and I will present our work about impacts of COVID-19 mobility restrictions on dietary interests. And this is a joint work with Arnaud from University of Fribourg and Bob from UPFL. The COVID-19 pandemic led to a widespread implementation of epidemiological interventions. So for example, in mid-May 2020, more than a third of the global population was under lockdown. And such interventions have created major shifts in people's lives. So our guiding questions are, how did dietary interests shift during COVID-19 mobility restrictions? And what foods are people interested in more or less when they spend more time at home? Our goal in this work is to understand and document the impacts. Very early on in the course of the pandemic, there were anecdotal reports about changes in dietary habits, about the increased interest in baking, and the increased popularity of preparing bread at home. Existing research studied the impact of COVID-19 stay-at-home orders on health behaviors. However, the evidence that exists relies primarily on surveys and is focused on country-specific behaviors. So it remains challenging to quantify the shifts in food interests globally and holistically across different food types. However, the widespread internet access enables us to explore the impact of the pandemic via digital traces as a proxy. So we conduct a population-wide study where we study Google Trends, aggregated interest traces based on Google searches. So specifically, we curated and collected interest time series for a set of 1,400 concepts related to specific foods, such as, for example, bread or pizza, and 17 concepts related to ways of accessing food, for example, recipe or food delivery. Now, search queries that users issue to Google are typically specified in plain text, and we use free-base identifiers since they allow grouping different surface forms related to the same topic. So various surface forms related to cookie are all mapped to the same cookie entity. And since Google Trends search interest time series are normalized and rounded, we calibrate the time series. So in that way, we measure search interest for a given entity directly proportional to the number of search queries up to bounded precision. And we further categorize the food entities into categories of food. So for example, cookie would be a dessert. Then we collect time series in 12 countries at weekly granularity. And here we see an example of interest time series across 2 years, 2019 and 2020 in Australia and Brazil. And then next, we examine how the total interest in all food entities evolved in 2019 and 2020. So across 12 countries, we monitor the total interest in all food entities, normalized by the pre-pandemic mean and standard deviation. So first, we can note the peaks of interest in food during the end of year holiday season in 2019 and in 2020. And then second, during the first wave, we note the overall surge of interest in food, stronger in amplitude and longer lasting compared to the holiday season in 2019. So for example, in US alone, the surplus of interest in food at its peak during the first wave is equal to the surplus of interest in food during the week of Christmas. And in total, the surplus of interest in food in the first 6 months of 2020 in the US is equal to 9 times that of Christmas. However, methodologically, it is hard to attribute any changes in dietary interest to the pandemic, and we try to overcome these challenges by performing quasi-experimental time series analysis. So what does this mean? To do so, we combine interest time series with mobility data published by Google. So mobility data captures the percentage of time that people spend indoors compared to a pre-pandemic baseline. So here, again, in the example of Australia and Brazil, on x-axis we have time, and on y-axis the percentage of time that people spend at home. And then we first automatically detect changes in the mobility time series caused by either government mandated lockdowns or social distancing. And then in that way, we detect the exact week when people started to spend substantially more time at home. That means more than 10% increase compared to a pre-pandemic baseline. And also we detect the week when people stopped spending substantially more time at home. And then given this abrupt nature of the change in mobility, the idea is to isolate the effect of the discontinuity in mobility patterns on food interests while accounting for 2019 trends and temporal regularities. So again, in the example of Australia and Brazil, we have time in x-axis relative to the sharp mobility change, and on y-axis, we have search interest in logarithmic scale. And here, entity level analysis come in handy since queries in different languages about the same thing are all mapped to the same concept. In orange, we have interest in 2020, and in blue, interest in 2019. We consider a number of weeks before and after the discontinuity to minimize the potential impact of other factors that have nothing to do with the discontinuity in mobility, and we fit a quadratic model to capture the temporal evolution. The model then lets us measure three key quantities. So first, we are able to measure the short-term effect of decreased mobility, controlling for trends and pre-pandemic regularities. So in this running example of Australia and Brazil, measuring short-term effect of decreased mobility, we observe 68% and 48% respectively, immediate jump in interest in pastry and bakery products, for example. And now applying this modeling approach across the 12 studied countries on x-axis and various food time series, we find that after the shock of mobility decrease, there was a strong immediate increase in interest in consuming food at home. So in all countries, there was a significant short-term increase in interest in recipes, ranging between 34% increase in Denmark and 180% increase in India. In all countries except in Brazil, there was a significantly decreased interest in restaurants, ranging between 32% increase in USA and 82% in France. Also, there were major increases in interest in food delivery, with more than 100% increase in 6 out of the 12 studied countries. Similarly, we can measure the short-term increase in interest in categories of food. So after the shock of mobility decrease, the most drastic increases in interest occur for calorie-dense carb-based food types. We find that the biggest increases occur for pastry and bakery product, bread and flatbread, pie, dessert. These effects are significant in most of the countries and as drastic as more than 2 times momentary increase in interest in pastry and bakery product and bread and flatbread in Spain and France, for example. An alternative view is not to consider the interest in different foods in isolation, but to model the share of interest allocated to a given category. So in that sense, the share of volume decreases significantly for foods whose growth in interest is not proportional to the growth of other foods. And again, the most prominent increases are observed for carb-based foods. The second quantity that we measure with our modeling approach is the time that it takes for interest to revert back to normal. So in the example of Brazil, we measure how many weeks after the mobility decrease within the 30 weeks window, the modeled interest in 2020, the year of the pandemic, is no longer significantly different from the counterfactual prediction based on interest in 2019. So this would be 26 weeks to go back to normal in the case of Brazil. And then across all countries and all entities, we estimate that there were months of modified dietary interest, the shortest duration of increased interest in recipes being 70 weeks in Denmark, and the shortest duration of increased interest in specific food categories being 9 weeks for wine, beer, and liquor in France. And finally, the third quantity that we measure, in case the interest did not go back to normal within the 30 weeks after the mobility decrease, is how elevated the interest remains at the end of the modeled period, 30 weeks after mobility decrease, compared to the interest in the same week in 2019. So in the example of Australia, there is a lingering 35.7% increase in interest in bakery, even 30 weeks after the mobility decrease, when mobility already went back to normal. And we noted that while most increases come back to normal within 30 weeks, there are some notable exceptions of more permanent changes, especially in the case of Australia, and future work should determine if these are some new permanent habits brought by the pandemic or if they will fall back to normal at some point in the future. I wanted to finish with a couple of main takeaways from this study. First, during the first wave of the COVID-19 pandemic, there was an overall surge in interest in food, larger and longer lasting compared to those that occurred during holidays. And this is really important because holidays are known to be disruptive to dietary habits and a hazard to balanced diets. So since the effects of confinement on food interests are comparable in amplitude and last longer, from the public health perspective, there is a pressing need to understand them. Second, we found that in addition to the volume of interest in food increasing, also the nature of the type of food that populations are interested in changed. So it's not more of the same. When stressed and confined, people are interested in carbohydrates and calorie-dense foods, with drastic up to 3-fold increases in interest occurring in 11 out of the 12 studied countries. These effects are quite consistent across countries, which is a demonstration that they occur across cultures and economic conditions. In order to formulate policies and allocate resources, stakeholders need reliable and timely data. The results presented here provide documentation of the impacts of confinement on nutritional interests, and these findings can inform decisions made by governments and organizations. Future work should study traces of individual users in a longitudinal user-level study to understand what kinds of pre-pandemic characteristics are predictive of behaviors emerging during confinement. And going forward, as the pandemic continues to unfold, warnings about many different dangers of confinement emerge, such as alcohol misuse or obesity. However, it remains unclear which specific behaviors to focus on, and we hope to provide insights about the most prominent emerging behaviors, such as the increased interest in carb-based foods. Thank you for your attention, and I'm happy to take any questions in the live Q&A.